54-year-old male with right flank pain. This is CT scan of the abdomen and the pelvis. Both kidneys are enlarged and contain or replaced by multiple cysts of variable sizes. Can you see the multiple cysts of variable sizes? Many of these cysts are noted to be of high attenuation. High attenuation. Consistent with either hemorrhage or proteinaceous material. So, in a case of polycystic kidney and the patient is complaining of flank pain, acute flank pain, think of rupture of one of these cysts. So, what are the signs of cyst rupture? Look at the perinephric fat. Okay, so look at the perinephric fat. Try to look for perinephric fat stranding, as you can see here. The perinephric fat stranding started here in the anterior aspect of the perinephric space, seen anterior to the lower pole of the right kidney. This is the lower pole of the right kidney. If you go down, this is the perinephric fat stranding in the anterior aspect of the right kidney lower pole. If you go down, perinephric fat stranding is still seen. The perinephric fat stranding is still seen anterior to the lower pole of the kidney. If you go down, the perinephric fat stranding extends down to be anterior to the right psoas muscle. This perinephric fat stranding may be due to bleeding related to rupture of one of the cysts in the lower pole of the right kidney. So you need to check carefully the lower pole of the right kidney for the cyst. You need to look for the cyst that is the source of this bleeding. Can you see the cyst? There is a moderate sized cyst in the medial aspect of the lower pole of the right kidney, and there are linear hyperdensities extending from this cyst toward the area of the fat stranding. Okay, I will show you this. Look carefully. So the cyst is here. Can you see this linear hyperdensity? Yes, yes. Again, linear hyperdensity extending toward the area. No collecting system dilatation and no renal calculi. As you can see here, there is no dilatation of the proximal ureters, no dilatation of the renal pelvis, indicated by the presence of the renal sinus fat. This fat means that there is no fluid accumulation here in the pelvis, and there is no dilatation of the calyceal system, so no collecting system dilatation. No renal calculi. Okay. Early sigmoid diverticular disease. I will show you. Okay, where to look for the sigmoid colon? At the plate. At the plate. Okay, this is the plate. This is the sacroiliac joint. And here, the bowel loop that is seen within the plate. It's not lumbar, okay? If you are Egyptian, you will understand. This is not lumbar. This is the sigmoid colon that is seen at the level of the plate. And this sigmoid colon doesn't contain rice. It contains air pockets in its wall. Air pockets. Air containing outpouching from the lumen into the wall. This is the diverticular disease of the sigmoid colon. Okay, diverticular disease. Okay, this is the lumen. The air is supposed to be seen only in the lumen, not in the wall. Okay, the interpretation here: perinephric fat stranding anterior to the lower pole of the right kidney, as well as the right psoas muscle, with a background of renal and liver cystic disease in a patient with right flank pain. The most likely diagnosis is polycystic kidney and liver disease with acute rupture or bleed on the right. I would discuss this case with the renal physicians, or I would recommend urological referral. That's it.